Hello, seniors. You clear your throat again, but a few minutes later, that sticky feeling is back. You swallow, cough gently, drink some water, and still feel as if something is sitting in the back of your throat. If this happens to you every day, there may be a reason that has nothing to do with a simple cold. For many adults over 60, persistent throat mucus becomes something they simply learn to live with. They may call it allergies, aging, or just phlegm. But when mucus seems to be there constantly, your body may be responding to irritation somewhere along the nose, sinuses, throat, stomach, or even the medications you take. And here's what makes this confusing. The mucus you feel in your throat is not necessarily being produced in your throat. In many cases, the sensation begins somewhere else. Understanding where it starts can completely change how you approach the problem. Your respiratory system normally produces mucus every day. That is not a bad thing. Mucus helps trap dust, particles, and microorganisms before they travel deeper into your airways. It also keeps delicate tissues from becoming too dry. The problem is not mucus itself. The problem can occur when your body produces more mucus, when mucus becomes thicker, when it does not drain normally, or when the tissues in your nose and throat become irritated. Imagine the lining of your nose and airways as a protective surface. When that surface is exposed to an irritant, your body may respond by increasing mucus production. The mucus then has to go somewhere. And this brings us to one of the most common explanations for that constant lump or drainage sensation: postnasal drip. Postnasal drip happens when mucus from the nose or sinuses moves toward the back of the throat. You may not always feel liquid actually dripping. Instead, you may notice frequent throat clearing, coughing, a tickling sensation, hoarseness, or the feeling that something is stuck. Allergies can contribute to this, but they are not the only possibility. Changes in weather, dust, smoke, fragrances, dry indoor air, infections, and inflammation inside the nasal passages can also affect mucus production and drainage. This is especially important as we get older because nasal tissues and the way mucus moves through the upper airway can change over time. Some medications can also contribute indirectly by causing dryness, which may make normal mucus feel thicker and more noticeable. But there is another possibility that many people completely overlook. Sometimes the problem is not primarily coming from the nose. It may be related to what is happening lower down, near the stomach and esophagus. You may know acid reflux as the burning sensation people call heartburn. But reflux does not always feel like heartburn. Some people experience what clinicians refer to as laryngopharyngeal reflux, where stomach contents reach the upper throat area and irritate sensitive tissues. When that happens, a person may experience throat clearing, hoarseness, coughing, a sensation of mucus, a lump in the throat, or a need to repeatedly swallow. And they may have little or no classic burning sensation in the chest. This is one reason persistent throat mucus can be so frustrating. You can keep treating it as an allergy problem when reflux, nasal irritation, or another cause may actually be contributing. Now, before you decide that reflux is the answer, there is an important warning. Not every case of throat mucus is reflux, and assuming that every throat symptom is caused by acid can lead people to overlook other conditions. Persistent symptoms deserve a proper evaluation, especially when they are new, worsening, or accompanied by other warning signs. Another major factor is dehydration. As you age, your sense of thirst may become less reliable. Some medications can also affect fluid balance or contribute to dry mouth. When your body does not have enough fluid, mucus can become thicker and harder to clear. Think about the difference between a thin liquid and something sticky and concentrated. The same basic material can feel completely different depending on how much water is present. That is why some people notice their throat feels worse in the morning. You have gone several hours without drinking, you may have breathed through your mouth while sleeping, and your mouth and throat can become noticeably dry. If you wake up every morning feeling as though you have to clear your throat repeatedly, pay attention to what happens next. Does it improve after drinking water? Does your nose feel blocked? Do you sleep with your mouth open? Do you snore? Do you wake with a dry mouth? Those details can provide useful clues. And there is another overlooked cause: mouth breathing. If your nose is congested, you may naturally begin breathing through your mouth. This can dry the tissues in your mouth and throat. The result may be irritation, thicker secretions, and more throat clearing. But here is where a frustrating cycle can begin. You feel mucus, so you clear your throat. The throat clearing irritates the tissues. The irritation creates more sensitivity. You feel something there again, so you clear your throat once more. Before long, you may be clearing your throat dozens of times throughout the day. The sensation is real, but the constant mechanical irritation may actually help keep the cycle going. Instead of aggressively hacking or repeatedly clearing your throat, try swallowing gently or taking a sip of water when appropriate. A warm, non-irritating drink may also feel soothing for some people. The goal is not to force every bit of mucus out. Your body already has natural systems for moving mucus away from the airways. There is also something else worth considering: the medications you take. Older adults are more likely to use multiple prescription and over-the-counter medications. Some medications can contribute to dry mouth or changes in nasal secretions. That does not mean you should stop taking them. Absolutely do not stop a prescribed medication simply because you suspect it is contributing to throat symptoms. Instead, ask your doctor or pharmacist whether any of your medications could be contributing to dryness, throat irritation, or changes in secretions. Sometimes a medication review can reveal something that was easy to miss. And please remember that natural does not automatically mean harmless. Some people respond to herbal products, supplements, essential oils, or strong home remedies with irritation or allergic reactions. Your throat is sensitive tissue. More is not always better. Now let's talk about something that worries many older adults: the color of the mucus. You may see clear mucus, white mucus, yellow mucus, or occasionally greenish mucus, and immediately assume that you have a bacterial infection. But mucus color alone does not reliably tell you what is causing the problem. Mucus can change color when immune cells, proteins, cellular material, or environmental particles become mixed with it. A change in color does not automatically mean you need an antibiotic. This is particularly important because unnecessary antibiotics can cause side effects and contribute to antibiotic resistance. The right treatment depends on the overall symptoms and the underlying cause, not simply the color of what you cough or clear from your throat. So what can you do if you constantly feel mucus in your throat? Start with the basics. Stay adequately hydrated unless your healthcare professional has specifically instructed you to restrict fluids. If you have a medical condition that requires fluid restriction, follow the advice given by your healthcare team rather than using a general hydration recommendation. Pay attention to your environment. Smoke, dust, strong fragrances, and very dry air can irritate the nose and throat in some people. If your home air is extremely dry, appropriate humidification may help, but humidifiers need to be cleaned properly because poorly maintained devices can introduce unwanted particles or microorganisms into the air. If nasal congestion seems to be part of the problem, discuss appropriate nasal care with a healthcare professional. Saline nasal products are commonly used to moisturize and rinse nasal passages, but if you perform nasal irrigation, use a properly prepared solution and follow safe instructions. Never improvise with untreated tap water for nasal irrigation. If you suspect reflux, look for patterns rather than guessing. Do symptoms become worse after large meals? Do they occur when lying down? Do you notice hoarseness in the morning, frequent belching, a sour taste, a chronic cough? These patterns can be useful information to share with your doctor, and do not assume you must have severe heartburn for reflux to be involved. At the same time, do not automatically blame reflux for everything. Persistent throat symptoms can have several causes, and sometimes more than one factor is involved. For example, imagine someone with nasal congestion who breathes through the mouth at night. They wake with a dry throat, begin clearing it repeatedly, and also happen to have occasional reflux. In that situation, there may not be one single cause. There may be a combination of dryness, nasal irritation, throat sensitivity, and reflux. This is why treating the real cause matters more than simply trying one remedy after another. Another factor worth mentioning is smoking and exposure to secondhand smoke. Smoke can irritate the respiratory tract and influence mucus production and coughing. If you smoke, quitting is one of the most important things you can do for your respiratory health. If you do not smoke, reducing exposure to secondhand smoke is also worthwhile. And if you have seasonal allergies, do not ignore the possibility simply because you did not have severe allergies when you were younger. Allergy symptoms can change over time. Persistent congestion, sneezing, itchy eyes, and clear nasal drainage may point toward an allergic component, but there are times when persistent mucus should not be treated as a minor nuisance. If you have difficulty breathing, chest pain, coughing up blood, significant difficulty swallowing, unexplained weight loss, persistent fever, severe weakness, or a cough that does not go away, you should seek medical evaluation rather than relying on home remedies. Likewise, persistent hoarseness deserves attention, particularly if it continues for several weeks or occurs along with difficulty swallowing, a neck lump, breathing problems, or other concerning symptoms. And if you feel as though food is getting stuck when you swallow, do not simply assume that mucus is the problem. Difficulty swallowing can have several causes and should be assessed. There is another important distinction. A sensation of mucus is not always the same thing as having excessive mucus. Sometimes the throat feels coated or blocked even though there is not a large amount of mucus present. Reflux, dryness, irritation, muscle tension, and heightened throat sensitivity can all contribute to that sensation. This is why repeatedly trying to get the mucus out may not solve the underlying issue. Your goal should be to understand why the sensation is occurring. For some people, the answer may be nasal inflammation. For others, it may be reflux. For someone else, it may be dry air, dehydration, medication-related dryness, allergies, smoking exposure, or a combination of several factors. And this is especially relevant after 60 because your body does not necessarily respond to everyday stressors exactly as it did at 30 or 40. The tissues may be more sensitive. Medications may play a larger role. Chronic conditions can influence hydration and breathing. Sleep patterns can change. Nasal congestion can become more noticeable. And small irritations can sometimes become persistent problems. That does not mean persistent mucus is simply part of getting old. Aging can change the way your body works, but ongoing symptoms should not automatically be dismissed as aging. If this problem has been bothering you for weeks or months, make a simple record before your next appointment. Write down when it is worst, whether it happens after meals, whether it is worse when lying down, whether your nose is blocked, whether you wake with a dry mouth, and whether certain environments make it worse. That information can be surprisingly useful. Your healthcare professional may then decide whether your symptoms fit better with nasal inflammation, allergies, reflux, medication effects, infection, or another condition. Depending on your symptoms, they may recommend further evaluation rather than simply treating the mucus itself. And remember something important. You do not need to be embarrassed about frequent throat clearing. It is a common symptom, and there is usually a reason your body is producing the sensation. The key is finding the reason instead of endlessly fighting the symptom. If you are watching this and thinking, that sounds exactly like me, pay attention to the pattern. Is your throat worse in the morning? Is it worse after eating? Is your nose congested? Do you sleep with your mouth open? Do you take several medications that cause dryness? Those clues can help you and your healthcare professional narrow down what is happening. And if you have been repeatedly clearing your throat all day, try breaking the cycle gently. Instead of forcefully clearing your throat every time you feel a sensation, consider swallowing, sipping water when appropriate, or taking a moment to breathe comfortably through your nose if your nasal passages are clear. Small changes may reduce irritation, but they should not replace medical evaluation when symptoms persist. The bigger lesson is this: mucus is not your enemy. It is part of your body's defense system. What matters is why you are producing more of it, why it feels thicker, or why your throat continues to sense it. Once you understand that, the problem becomes much less mysterious. And please remember, this information is educational. It cannot determine the cause of your symptoms personally. If you have ongoing throat mucus, frequent coughing, persistent hoarseness, swallowing difficulty, breathing problems, or any other concerning symptom, speak with a qualified healthcare professional. Do not stop prescription medication on your own, and do not begin high-dose supplements or medications simply because you saw them recommended online. Your body is giving you information. The goal is not to panic about every symptom. The goal is to listen carefully, recognize patterns, and get the right explanation when something continues. If you regularly deal with mucus or throat clearing, tell me in the comments. Is it worse in the morning, after eating, or throughout the entire day? Your experience may help someone else recognize a pattern they have been overlooking. And if you want more evidence-based explanations about the health changes that can become more important after 60, keep learning, keep asking questions, and most importantly, do not ignore symptoms simply because you assume they are a normal part of aging.